Hello friends, in this video I am going to discuss about dementia with Lewy body. In the lecture on Parkinson's disease, I told you Lewy body deposition is a feature of Parkinson's disease, and Lewy body they are made of alpha-synuclein. They are made up of alpha-synuclein. And Lewy bodies are usually found in Parkinson's disease. Okay. And in this condition, dementia with Lewy body, also you are going to get alpha-synuclein. Dementia with Lewy body, it has four important clinical features. The first one is visual hallucination. Then fluctuating cognition. Then RBD, that is REM sleep behavioral disorder. And Parkinsonism. So one point I want you to understand that in Parkinsonism, the movement disorders or movement abnormalities will come first, and gradually as the disease progresses, there will be involvement of the cortex. And whenever there is involvement of the cortex, those patients can also have dementia. Okay. So in a late stage of Parkinson's disease, the patient can have dementia because of cortical involvement. What happens in dementia with Lewy body? Here also you are getting features of Parkinsonism. Here also you are getting dementia. So how will you differentiate? So the basic difference is in these patients, dementia is the predominant feature, and dementia usually comes early. Okay, because here the pattern of spread is descending, that is from the cortex to the basal ganglia and then probably to the brainstem. So this is known as the descending spread. So the pathology means deposition of the Lewy bodies. So the deposition of the Lewy bodies happens from the cortex, then the basal ganglia, then the brainstem. So that's why these patients will have predominant cortical involvement, and also they can have later Parkinsonian features. But in Parkinson's disease, you will have ascending spread. That means it will start from the brainstem. I told you the predominant involvement is substantia nigra, which is present in the midbrain. So in Parkinson's disease, it is the brainstem that is affected first, then other structures of the basal ganglia, and then it will involve the cortex. That's why in Parkinson's disease, the onset of the disease or onset of the movement disorder and the dementia, they are separated by at least 1 year of gap. Okay. So in Parkinson's disease, onset of the interval between the motor symptoms and onset of dementia is usually 1 year apart. However, in dementia with Lewy body, the interval between the motor symptoms and dementia is less than 1 year. So these are the important points of difference between Parkinson's disease with dementia and dementia with Lewy body. Okay, Parkinson's disease can have secondary dementia, but that is a late feature because it has ascending spread. In dementia with Lewy body, it has a descending spread. So dementia is a predominant feature and it happens early. Usually, interval between motor symptoms and dementia is less than 1 year. Okay, and both of them will have Lewy bodies which are made up of alpha-synuclein. Okay, and apart from that, this disease will also have visual hallucinations and fluctuating cognition. These are important unique features of DLBs. REM sleep behavior disorder can also be found in Parkinson disease. Okay, so that's all about the dementia with Lewy body.